Thank you for joining us. I have John Snedegar and Dr. Michael DeYoung, who's here with us from LaSara Medical Group. How did LaSara Medical Group begin?
Well, we specialize in treating men with erectile dysfunction, and we originally had learned about this treatment when we read about it in the Wall Street Journal. And at first, when I say we, it was my father and I, and when we first read about it, we were thinking, oh, it's kind of interesting, shockwave therapy for men with erectile dysfunction. What does that actually mean? For me, I immediately thought, I think of shockwaves as a car battery, so I'm thinking that sounds a little intense. We started to do a little more research, and as we did research, we learned what the treatment is all about, and the whole purpose of it is to take a man who can't perform naturally and bring him back to being able to function naturally. Mm-hmm. As the days went on and we thought about it, we started understanding the more details of what is available to men if you don't have shockwave therapy. Mm-hmm. And unfortunately, those options are tough for guys. Most men don't like taking, for instance, the common modalities of like a Viagra or a Cialis and so on. So we thought, hey, no one really does this. No one does it well. Might as well see if we can explore this opportunity.
Mm-hmm. Okay. All right. And then, you know, you're talking about the other types of options that people can do. Are there other options like surgery and things too, or is it just the pill forms?
There are. So typically when you have erectile dysfunction, the first path of treatment is being prescribed Viagra or Cialis or Levitra and other modalities like that.
Right.
Secondary, most men will then learn about injection therapy, where you literally inject a medication directly into the shaft of one's penis. Mm-hmm. Obviously, that sounds a little intense. It can be a bit intense. So most men don't want to go down that path. And the third option is getting into a surgical implant. Of course, with surgery, there can be a lot of negatives that can come with that. Mm-hmm. So most men don't want to go down that path, and once you do go down that path, there's no going back.
Okay. So we're talking about shockwave therapy, right?
Yes.
Can you elaborate on that?
Well, it's low intensity shockwave therapy, and probably the shock puts people on the wrong track.
I would imagine.
It's not a shock. Mm-hmm. You can perceive it, you can feel it, but it's not uncomfortable in any way. Okay. Not when you receive it, and not the next day.
Okay.
It's low intensity sound waves, and that's probably a better way to understand it.
Okay.
You can feel it, but it's not uncomfortable.
Okay. And what is it actually doing?
Simply, what it's trying to do is start a focused inflammation, very low-grade inflammation in the pudendal arteries. Mm-hmm. That secondarily stimulates neovascularization, which is new blood vessel growth of the pudendal arteries, the arteries that feed the penis. Mm-hmm. It's a slow process. It takes months, slower than bone growth. Mm. So it's not like a week later you're going to be changed. Mm-hmm. But in the process, you get rejuvenated, you get better blood flow to the pudendal arteries. Mm-hmm. That allows the whole beginning of an erection with the release of nitric oxide and the whole chemical cascade that follows after that.
Okay.
But the basis of this is having good blood flow.
Okay.
And the reasons we have erectile dysfunction is because we don't have good blood flow. Mm-hmm. Now, we don't have a whole bunch of guys in their 20s coming in, but we have a few. Mm-hmm. But it's primarily men 50 years and over. Mm-hmm. It's very common. 50% of men 50 and over will have mild to moderate dysfunction.
Okay.
And some will have a very severe dysfunction.
Okay.
So there's a wide spectrum in ages and in severity.
Is it possible that men might be suffering from sort of vascular disease that could cause it?
Well, probably 60% or more of it is vascular.
Okay.
20% or so is related to injuries from prostate therapy.
Okay.
And another 20% or so is psychosocial. Mm-hmm. And sometimes performance anxiety becomes as much of a problem, a psychological problem, almost like professional athletes. Mm-hmm. They get in a slump, and they can do it, they can physically do it, they just psychologically get into a place where they're not functioning very well.
Right.
So that's also a factor.
Okay.
But 60% of it's going to be vascular.
It's vascular, okay. Mm-hmm. So John, you talked a little bit about Viagra and Cialis and Levitra, and so if they're taking those types of medications, how is this particular treatment going to eliminate them from having to use those?
Hopefully,
Okay.
But they don't work against each other.
Okay.
So you can use both.
All right.
The pills essentially slow down the degradation of the enzyme that breaks down the nitric oxide. So it gives you a longer concentration of nitric oxide and a longer duration.
Okay.
That's how the pills work.
Okay.
The injection therapy works by actually injecting into the sidewall of the penis three very potent vasodilators. It's called Trimix.
Okay.
And that works within 10 or 15 minutes.
Okay.
And that works for about 90% of the people. But it's cumbersome.
Right.
You have to get over the idea of injection, which is purely psychological. It's not physical. It's just people think, that's the last thing in the world I'm ever going to do.
Right.
I mean, I can't tell you, 95% of men say, okay,
Yeah.
you can just erase that
Right.
as an option, because we're not going needles there.
Right.
You know,
right.
and that's,
Well, wouldn't that be more of a short-term situation as well, as opposed to what you're proposing?
That absolutely is. I mean, the best way to think about focused shockwave therapy, what this treatment is to do a few things, as Dr. DeYoung was just saying. One is to stimulate neovascularization, which is blood vessel growth. Think of it as you're putting fresh plumbing in. When you have fresh, clean pipes, it's a massive amount of blood flow can come into the penis, which allows for someone to get a full erection. Second, when you have erectile dysfunction, the soft tissue in the penis can essentially become unhealthy, and shock waves help to stimulate the repair of the soft tissue, so the elasticity of a man's penis begins to come back. So typically we see the majority of our guys that come in and do this treatment start to see more blood flow. They start to see that their penis is actually increasing in size in some ways just because they're getting more blood flow. And as Dr. DeYoung was saying, it's not an overnight fix by any means, but it is a long-term fix. So once it starts to take effect, we see men begin to come back to natural functionality where they are with their wife or their lover or whoever it might be, and they can react naturally and get an erection and be able to go about their business, compared to having a time when they take a pill, or maybe having side effects, or maybe they had too much food before and now the pill's not reacting, or not having to stick a needle in themselves. So that's the ultimate goal of this type of treatment. And after having done this for a year and seeing what the effects are, we really expect just about every single guy to have a positive reaction.
Okay.
It just comes down to what degree. And the majority of them do get back to having full erections again, not having to rely on the medications that they've had to use before.
Is it a permanent result?
probably nothing is permanent
Right.
except taxes. But 80% of the people that get this treatment will have a positive response.
Okay.
And there's kind of a gold standard for that.
So if they want more information about it, you have a website, and that's LaSara.com.
That's right.
Okay, and then you also have a phone number that they could call as well. And what can the patients expect when they walk into your office?
Well, first, if they have questions, the best thing would be to call in and talk to one of our counselors, either myself or the rest of our team. We're very educated in this space, and specifically how this affects people.
Okay.
So you typically have a conversation with us. It is a bit uncomfortable for some to have that type of conversation, but we can assure just about every single person that we've heard just about everything you can imagine.
Right.
So we like to have a conversation over the phone, explain what this is all about. They then come in, have a medical evaluation from Dr. DeYoung,
Okay.
and at that point, after they've learned more about the treatment and we have confirmed that they are a great candidate for this treatment, then we offer it up for them, and then they can start treatment right away. Really, as you know, maybe they have known or see on our website, we're just right up in Tustin. It's about 15 minutes door to door from Laguna Woods. So it's quite simple, and each session takes about 30 minutes as well. So you're typically about in and out, and it's really a relatively easy experience.
All right.
It's kind of interesting that if you videotaped a bar with nothing but men in drinking and talking, erectile dysfunction would not be one of the topics that would come up.
Probably not.
Ever.
I don't think anyone's going to admit to that, right?
No.
But it's interesting when they come into the office that they finally get a chance to talk to somebody.
Right.
We make them feel very much relieved. I've been doing clinical medicine for over 40 years.
Okay.
So you just say, this is common. What are we going to do about it? How's it affecting you? And just sit down and have a very relaxed, we're not in a hurry conversation, because everything's a bit different.
Right.
Some people have diabetes, Some people are still trying to smoke and do this, which is very challenging. They shouldn't be doing that. But there's all kinds of variations, and you just have to take a little time and talk about it.
Okay.
Some people are in relationships. Our oldest gentleman is like 95 years old.
Wow.
They're not chasing young women. They want to have intimacy with their wife that they've
Right.
been with for 60 plus years.
Right.
And it's very important.
Right.
So there's all kinds of variances on this. And
Okay.
we have a very nice office, and it's very relaxed. And
Perfect.
people are very comfortable to be there, actually.
All right. Well, sounds great. Well, thank you very much for the information. I appreciate you both being here.
Well, thank you
Of
very
course.
much, Lisa.
Thank you, Lisa.
All right. And for more information, you can visit their website, LaSara.com. Thank you for joining us.